Hi, it's Kelly Shepard coming to you from my channel on YouTube, Breathe Easy Wheezy. You can also find me on my website, breatheeasywheezy.com, and Instagram, Breathe Easy Wheezy with underscores between the words. And you can also find me on Facebook at Kelly Shepard or Breathe Easy Wheezy, and that is BreatheEasywheezy. Today, I thought we would talk about this guy, an oximeter. Some of us have these. These guys are really cool guys. So if we have lung disease, we might have one of these. And certainly if you've been to the doctor, you've had this checked. If you've been in the emergency room, we love to put these on you. And gosh, if you've ridden in the ambulance, of course they put one on you. So these little guys you open and they go right on your finger, and then basically what they do, what we use them for, is to tell us what is your oxygen level. So specifically, how much of your blood is saturated in oxygen. So right now I'm reading 98%. I'm a little disappointed in myself. Normally I'm 98, 99, or 100%. I'm an asthmatic, and we tend to be what I call super diffusers. We diffuse oxygen at a very high level. Don't ask me why. We think it's a compensatory mechanism. So we think that when people are having asthma attacks and they're having a really hard time breathing, that they diffuse at a higher rate. It's kind of, we think it's an evolutionary process to help keep them alive, but we're not sure. That's the real answer. We don't know. We don't know. That's our best guess. Okay. So, but you know, a lot of other people with different kinds of lung diseases, they use these too. So oxygen levels, what's a good oxygen level? Well, I just told you mine was reading 98, so that tells me that 98% of my blood is running around with oxygen, so only 2% is running around without it. I like to see people 90% or higher. Every now and again, I'll get somebody who has emphysema or emphysema and bronchitis, and the doctor will be like, you know what, 88 to 92 is good. Every now and again, I get an 86 to 90% is good, or an 86 to 88%, something like that. I personally like to see people 90% and above, but you need to go with what your doctor, the range he has set for you, okay? Your doctor knows you better than I do. I am not your doctor, and I am a respiratory therapist, but I am not your respiratory therapist, okay? If you come see me in the hospital, that's when I'm your respiratory therapist. Anyway, so now we know what it does. If my oxygen level's at 85%, then that's telling me 15% of my blood is running around without oxygen. Once we go below 90%, then we're having cellular death. Some cells, some tissue in your body is dying because of low oxygen level, lack of oxygen. So that's not okay with me. I don't know about you guys, but I don't know all the cells that I have, but the ones that I do have, I want to keep, especially the cells in my lungs, because if I have lung disease, like the quicker those cells die, the quicker my disease progresses. I don't want that, right? I want to slow down any progression of the disease process. So I want to keep all of my cells. I want to keep them happy. Anyway, I'm not going to give that analogy. Something just popped in my head, but I'm not going to give it. So let's talk about what are the numbers that we see on here. Oh gosh, I must have died and I didn't even know it. Oh, maybe. Well, I know I'm not dead because I'm talking to you, but I was thinking maybe my batteries died, but there we go. We got it to work. So most oximeters will give you two values. This one gives you your SpO2 and your heart rate. Most of them do both. So SpO2, that just means saturation of peripheral, meaning way out here on our extremities, our fingers or our toes, maybe our ears, maybe our nose. So way out on the periphery, and O2 oxygen level, saturation of peripheral oxygen level. And the other thing that it calculates for you is your heart rate or your pulse. So it may say HR, it may say pulse, or you may just be like mine and just have a little picture of a heart. They're all a little different. And you can see I also have like a little blinky light down here. We'll talk about that blinky light just a minute. But let's talk about how this guy works. So to know how it works, I have to open it up and show you. So I'm going to pop it off my finger and I'm going to show you. It works on infrared technology. So when that guy comes off, you can see my little infrared light. Please do not stare directly into the light for extended periods of time. No. But anyway, so I put that on. It reads through my finger and it calculates how much of my hemoglobin, it's a fancy word, is bound up with oxygen. So hemoglobin, all that is it's a part of the red blood cell that the oxygen binds to. So the hemoglobin is the part of the red blood cell that carries the oxygen to the tissue. Really important player here, right? Okay, MVP, he's one of them. So that's how that guy works. So there are some things that can give us inaccurate results. Let's talk about that, because if you're using this at home as a diagnostic tool, like how am I doing, checking in with yourself, then if you're getting inaccurate results, that's not good. That's not useful data for you. It's not useful information. So I want you to be able to minimize that. So a lot of times what I see is when people have these, they put it on and, well, we're all American. So we want immediate gratification. Put it on my finger. What is my number? Tell me what it is now. And the first number that pops up, they take it. I like to let it settle in. This is a little computer inside of here. So it's been programmed. It's a piece of equipment. It is not smart. It's only as smart as the computer program that was written for it. So you got to give it a minute because it's calculating based on time what your heart rate is, and it's also calculating how much of your hemoglobin is bound with oxygen. You got to give it a little bit of time. Now the little blinky light on mine, you can see if I move it around a whole lot, it changes color. So I might go from green to yellow. Mine will also blink red and orange. So if it's red, it's saying, hey, these results are not accurate. And if it's saying orange, we're still iffy. If it's yellow, I'm just kind of looking at my patient, seeing does everything match up. So for you, it would be, what you're seeing here, does it match up with how you feel or what your normals are for this situation? And green means good to go. But I'll be honest with you, most of the oximeters that people bring in and show me that they bought in pharmacies or they bought them online, or they might have even bought them at a place like REI, something like that. So most of them, when they bring them in, I recommend you get yours from a pharmacy rather than REI. No offense, REI, I absolutely love you, but that's meant for mountain climbing. I'd rather you have one meant for medical use. So I really don't mean to offend you, REI. I like your store. But anyway, so dang it, I forgot where I was going with that. Oh, most of them don't have the light. They don't have the color light. What they have is they have a waveform. And so a waveform, well, it looks like waves. And if it's a real rough day on the sea, there's lots of waves, it's telling you it's accurate. And if there's every now and again just a little blip, blip, or it's flatline, okay, we all know what flatline means, nothing good. Because we've watched ER and Chicago Hope and Grey's Anatomy and all of those. Flatline is never good. And certainly don't be thinking about doing it on my shift, all right? I don't want to work that hard. I will, but just save it for the next shift. So anyway, you want to make sure you have really good waveforms. It's telling you that, yes, we're getting accurate results. And the more calm the ocean is, and certainly if it's flat, a flat line, not accurate, okay? So Most of them have the waveform, but I do see a lot of what I call light bars, where they're little bars and they light up and they'll go and then down, up and down, up and down. We don't need the sound effects. So if the little light bars are only going up about a quarter of the way, probably not accurate. If we're going up 3/4 of the way or all the way, it's telling you that it's reading more accurately. Okay, so the higher it goes, whether it's going this way or whether it's oriented to go up your screen that way, the more accurate the results are. And of course my wiener dog would find the squeaky toy in the middle of the video. So anyway, so that's how you can, your device is telling you that it's accurate or it's not. Movement can change it. So if you are working or doing something, maybe you're exercising and you're checking it. So just like hold that steady. If you're on a treadmill or something, just kind of gently rest your fingers on the bar, on that hand. Obviously, if you're unsteady on your feet, stop the treadmill so that you can hold on and not be on a moving surface, just trying to like balance this in the air or just gently resting it somewhere. Your safety is most important. But if you're like squeezing, giving the death hold on the treadmill, that can cut off the arterial flow to the fingertips, and that can give us false low readings, inaccurately low. So these are kind of sensitive technology. The other thing is if your hands are icy cold, so you put them on somebody and they're like, oh my gosh, get that off of me. Well, then you need to warm up your hands, because if they're icy cold, there's no blood flow going there. That's why they're cold. And if there's no blood flow, how can this guy check how much of your blood is saturated with oxygen? And if there's no blood flow, how can he sense the pulse or the movement of the blood through the fingertip to calculate your heart rate accurately? Not gonna happen, okay? So we need warm extremities, and we also need it not to be under really bright direct light. So if I'm doing chores out in my yard, maybe I'm raking my yard, or maybe I'm walking the dog, maybe I'm hunting moles, digging a hole, I don't know, whatever it is people do in their yard. I don't have moles, okay? Do not do that in my spare time, but I work with a nurse that is an avid mole hunter. But anyway, that's a whole nother story, and it's pretty funny, by the way. So if I'm outside and the sunlight is really bright, then because of that infrared technology, you just want to shield it from that bright light. So I would just have you like cup your hand over it and look at the results that way. And the other thing, you know, if it's like really, really bright lights inside, same thing, I would just kind of shield it, which is funny to me because a lot of times we use these in the emergency room with like super bright lights on people. So every now and again, I may place a blanket over my patient because for us, it shows up on the monitor, or I may just kind of hold my hand over it and make sure that the results on the monitor are accurate. And of course, on my monitor in the ER ICU, I'm looking at the waveform on the machine, just like you would be if you had a waveform on yours. And I've seen some of them that are pretty fancy that you can flip back and forth between the light bar and the waveform. So most of them I don't see with the little color light like what we have in the hospital. And so we want them warm. We want them out of direct light. And oh gosh, I'm wearing nail polish. So some of my nails are light color, and one of them on each hand is really dark. It's a dark blue. It's cute. It's dark blue with little snowflakes. It's seasonal, but it's a dark polish. So that little infrared light, it can have a hard time reading through dark polish. So typically my favorite place to check somebody's oximetry is on their ring finger or their middle finger. But because I have dark polish here, I would choose the next little guy over. And the reason for that is the ulnar artery leads directly to the ring finger and the middle finger. So if somebody was like this, you know, I would go for the middle finger. And I gotta tell you, it really makes my patient's day when they find that out, because they love to give me the middle finger. Everybody loves when I'm like, yeah, you know, either the ring finger or the middle finger. Whew, Yeah, a lot of birds go flying in that room after that point. So, uh, don't, please don't go flipping off your nurse or your doctor, your respiratory therapist, unless you have a good relationship with them and they think it's funny. Otherwise, um, I just wouldn't do it. I wouldn't do it because my mama would tell me not to. Okay, and I wouldn't want to offend anybody. So anyway, but then you're gonna get the best blood flow from there. Let's say I was a carpenter and maybe at some point I cut off this finger, or maybe I cut off like 3 fingers on that hand. I went to see the doctor, he sewed them back on. Probably not the best fingers to check this on because there's been trauma and there's scar tissue, and that can change the blood flow to that fingertip. So just choose a different one or go on a different hand, okay? And the other thing is smoke. So let's say I go outside and I smoke a cigarette. What do you think? I come inside right after smoking that cigarette. What do you think this is going to read? Do you think it's going to read like 100%? Or do you think it's going to read like 90% or 88%? Do you think it's going to read high or low? Remember, we want our oxygen level 90% or above for most of us. Well, what's going to happen is we're actually going to get a false high reading with smoke. So when people smoke cigarettes, or maybe they're outside around a fire pit or a bonfire, maybe they were cooking bacon in their house and it burned and the house got all smoked up. Smoke, and I don't care whether it's cigarette smoke or marijuana smoke or smoke from anything else, all smoke contains carbon monoxide. And carbon monoxide, we know, is a dangerous gas because when we inhale carbon monoxide, it binds to your hemoglobin, a part of your red blood cell that carries the oxygen. But its affinity for the hemoglobin, or how tightly it likes to hold on to the hemoglobin, its affinity is about 200 times stronger than oxygen. It's a little less than that, but it's about 200 times stronger. That's a lot stronger. So the way I think about it in my head is like once it's got on there, it's like it's glued on there. Doesn't want to come off. Where when our hemoglobin picks up oxygen, our heart pumps the blood around to the body and then the oxygen jumps off at the tissue level. Well, the carbon monoxide doesn't want to do that. And if it won't jump off, then there's no room for oxygen to get on there on the next trip through. So that's big danger, right? That's big danger because then we're depriving our cells and our tissues of oxygen. And if we do that, well, we have cellular death. And eventually we will have tissue death. So I don't know about you, but having lung disease, I want to keep all the lung tissue that I've got. I want that lung disease to progress as slowly as possible. I don't want to accelerate it. I don't want it to get real bad real quick. I want to slow it down. So just something for you to be aware of. If you go outside, you smoke your cigarette, you come back inside, wait at least 10 minutes before checking this little guy, okay? Give that carbon monoxide time to diffuse out of your body. And like I said, a lot of people, they put it on their finger real quick. They assume the results they're getting right away are accurate. Don't. The other thing I see is like when I pull this off and then I put this on, if there was a number on there, a lot of times there'll be a negative. So for mine, it was 98%. So it might say negative 98. And a lot of people are like, oh, what does that mean? It just means that it's not capturing yet. It just means be patient. Just be patient. So those are all the things you need to know about oximetry. Oh, except for one thing. One final thing. If you are anemic, if you have low levels of hemoglobin, so your doctor might call you anemic, then you're going to get false high readings because there's not enough hemoglobin. When you're anemic, your hemoglobin is low. Remember, those are the little guys that carry the oxygen. So if you're anemic, you have less carriers. So the few carriers or the few hemoglobin that you do have, a lot of oxygen is going to be on them, right? It's kind of like if I have normally have 20 UPS trucks and it's Christmas time. Oh, it is. And normally at Christmas time we're sending lots of packages to each other. But let's say I normally have 20 trucks, but half my fleet is down. Maybe I've got some flat tires. Maybe my transmission went out on some of them. Maybe my driver's called in sick. So instead of having 20 trucks, I now have 10 trucks. So now instead of 20 hemoglobin, I have 10 hemoglobin. And those UPS trucks, it's Christmas time, how full are they going to be of packages? Really full, right? We're going to get as many packages on each truck as we can. Same thing with your hemoglobin. If you are anemic or your hemoglobin's low, it's going to pack the oxygen on it. So you're going to get false high readings. And if you are a nurse and you're listening to this, then I would ask you to reference your oxygen hemoglobin dissociation curve. And that should give you some clarity on that. Okay? Anyway, I hope you guys have an awesome day. I hope you have a fabulous holiday season. I celebrate Christmas, so I'm going to say very Merry Christmas. And if you celebrate any other holiday, happy holidays to you. I hope you breathe easy, and I hope you are not wheezy through the holidays. You guys can find me at breatheasywheezy.com, BreatheEasywhy.com.